first thing is to really understand your personal risk, and broadly, the older you are, the higher your risk of cancer in general terms. If you're a smoker, if you're overweight, if you've got a strong family history of some cancers, that may increase your risk of cancer, but often not always. And if you drink more than the recommended guidelines, these are all things that could increase your risk of cancer. So the first thing I say is know your own risks, and then know your own body. People are aware of their bodies, and knowing when there's a change and that's unusual for you, but importantly, persistent changes. So if we were to talk about bowels, for example, many people's bowels change all the time. It depends on what they've eaten, how stressed they are, how much exercise they've had, how much water they've drunk. As GPs, what we're interested in is a persistent change in normal for you. And broadly, that applies to most cancers. And probably the most worrying symptom that worries all of us as GPs, if someone has persistent unexplained weight loss, is one of those things that should not be happening and definitely needs to be checked out. Then there's the skin lesions that aren't healing, or unexpected lumps or bumps or growths, and particularly if they're growing over a short period of time. Things that grow over a short period of time, it's really important to get those checked out.
So I think there's 6 ways that I would say that we could tackle this. So the most important is to stop smoking. That is the most preventable cause of cancer for all types of cancer. Is implicated in 70% of lung cancers. So definitely that would be my number 1. Number 2, try and reduce the amount of alcohol that you drink. We know that is implicated in a lot of cancers too. Try and maintain a healthy weight. Weight is implicated in endometrial cancer, but also breast cancer and bowel cancer as well. Try and have a healthy diet. Try not to stay in the sun too long. That will increase our risk of skin cancers. And move as much as you can. So exercise. We talk about the importance of exercise, not just to prevent cancers, but also to reduce our risk of heart disease as well. There's so many benefits to that. So ensuring that we do get out every day and get some resistance exercise as well, and just keep moving. There's no specific evidence to say that we should avoid certain foods or have more of certain foods at the moment in a particular type of food, and we'd worry maybe that people would become deficient in certain nutrients if they did avoid food groups. But having a healthy diet, lots of fruit and vegetables, high fibre, trying to avoid some processed foods, because we do know that is linked to bowel cancer, and red meat as well, so keeping that to a minimum, but making sure we get lots of those good proteins. So our white meat, our chicken, our fish, and our pulses and that sort of thing is a lot better for us. So we do say for men and women to try and have less than 14 units of alcohol a week. It doesn't matter what type of alcohol it is with regards to your cancer risk. And it also doesn't matter whether that's spread out or whether it's sort of binge drinking as such. When we're looking at cancer risk, I mean, it's obviously different in other circumstances, but from that cancer risk point of view, it's just staying below that 14 units a week.